Doctors are nervously watching what happens next week because it could foreshadow how bad the pandemic will get in December.
Doreen Gensler joins us with a closer look at what our local hospitals are doing to prepare. Doreen?
Yeah, I think we've already mentioned the CDC is urging people not to travel or gather in groups for the traditional Thanksgiving dinner this year as coronavirus cases surge here and all across the country. D.C. hospitals are already close to capacity, and many worry about a spike in new cases as people gather over the holidays.
Our actions now dictate what happens in the hospital 2 and 4 weeks from now.
It's an urgent plea from doctors to stay home and avoid large gatherings to slow the spread of COVID and to keep hospitals from becoming overwhelmed with patients. Dr. Glenn Wertman is with MedStar Washington Hospital Center. He says they're hoping for the best, but preparing for the worst.
Thanksgiving, Christmas, other holidays, this is almost sort of a perfect storm.
Will you have enough equipment, enough staff, enough beds?
I mean, at a certain point, you reach a limit. Hopefully, we'll be well below that limit. And really, it's in the control of the people of D.C. If people stay separated, wear their masks, we can keep the numbers down.
Intensive care units are filling up fast, and D.C.'s convention center, outfitted with mobile hospital rooms last spring, is on standby, prepared to treat patients if our local hospitals run out of room.
We want to be able to care for patients in the hospital. We don't want to be setting up field tents or caring for patients any place other than where we're used to caring for patients.
But cases continue to surge as pandemic fatigue sets in and people yearn to be with family and friends. The CDC is urging all of us not to travel for Thanksgiving and to cancel plans with relatives outside of our households. Doctors say ignoring that warning could be deadly.
Example, I have family in other states but will not be traveling because I think it is safest to remain at home right now in small groups, in close groups. Wear your masks.
Dr. Bruno Pettineau has been on the front lines treating patients at George Washington University Hospital since the outbreak started 8 months ago. He says it's taken a toll on his colleagues.
So our staff not only takes care of COVID patients, but we live in our community as well. We see all of the impact of COVID around us. We have staff members that have lost loved ones.
Now, news of a vaccine is giving hope to healthcare workers and people all across the country, lifting spirits in a year that's been just awful.
The vaccine news has just been phenomenal. I think it's put a bounce in everyone's step that this has been hard, but there is a light at the end of the tunnel.
Hospitals are working with D.C.'s Department of Health to develop a plan and a timeline for vaccinating our frontline healthcare workers once a vaccine is approved by the FDA. Just remember, we know what works when it comes to protecting ourselves from COVID. Wear a mask, avoid crowds, and try to stay socially distanced. It's important that we get this under control now. Flu season hasn't even started yet.